Video we are going to talk about some special test, specifically shoulder special test. First of all, why we need to do a special test? Basically, what we are doing in a special test are we are basically triggering or recreating the patient's pain by doing certain movements. We are trying to recreate the pain the patient has undergone, and recreating that symptoms or pain we cannot diagnose just because of a positive special test. We need to do other investigation. It is just a leading factor for a certain diagnosis, but it is not a definitive factor. But in exams and all, we can use it. We have much better diagnostic tool than special test in this era. Plus spinatus tendonitis, the tendon will get inflamed. Why? Because of an impingement. Chance of impingement is there, where the supraspinatus tendon is going below acromion process and above coracoid process. So it is between. So if this is my acromion, this is my coracoid, so between these structures goes the supraspinatus. So if the space between them reduce, supraspinatus will become impinged in them, and there's chances of pain. So basically in the special test, what we are doing, we are reducing again. We are trying to reduce the space between acromion and coracoid process and try to impinge the structures in while we are doing the test and recreating the pain. Usually two structures are involved: supraspinatus tendon and subacromial bursa are usually involved in the impingement. Coracoid and the acromion. The space between these two is the subacromial space. Two structures are involved. One is subacromial bursa and the supraspinatus tendon. So this is the supraspinatus muscle coming here. Here will be your acromion and here will be your coracoid. So between this area, two structures can be involved. One is supraspinatus tendon can involve, other is subacromial bursa. So usually when you internal rotate and lift, these structures can impinge between the two space, acromion and coracoid process, and patient will get pain.
Internal rotate the shoulder and take it into full flexion. If patient complain about pain with the same movement, the test is positive. Take patient arm to the opposite shoulder and lift it up. If patient complain about pain with this movement, the test is positive. Take shoulder into flexion and forcefully internal rotate. If patient complain about pain with this movement, test is positive. Take the shoulder to abduction and ask the patient to external rotate, give resistance. If patient complain about pain when you give resistance, the test is positive. Take the shoulder into flexion passively. Ask the patient to drop actively. Patient cannot bring down the hand actively with the controls and suddenly drop, test is positive. Take shoulder into 90 degree of flexion, external rotate and give resistance to the flexion. If patient complain about pain with the same movement at the shoulder, it is an indication of slap lesion. Shoulder internal rotation, 19 degree of flexion and 10 degree adduction. Give resistance to the shoulder flexion. If patient complain about pain when you give resistance at the shoulder, test is positive for labral tears. Humerus in neutral position, elbow in 19 degree. Ask the patient to external rotate and supinate. Therapist give resistance. If patient complains about pain at the shoulder, the test is positive. Patient's hands on the hip, thumb posteriorly. Therapist stabilize at the shoulder and one hand below the elbow. Patient is asked to push back the elbow and therapist resist this movement. If patient complain about pain, the test is positive. 90 degree elbow flexion, 90 degree shoulder flexion and external rotate. If patient complained about fear, anxiety or apprehension, the test is positive for instability. If patient complained about pain with external rotation, posterior impingement might be there. If apprehension test is positive, we can further confirm anterior instability with the job relocation test. Take shoulder into 90 degree abduction, elbow 90 degree flexion and external rotation. Give a posterior glide. When you give posterior glide to the shoulder, patient pain or apprehension reduces That means it is a positive test.